Hi, my name is Kate Glazer. I'm here with Heidi Mix from Genesee Valley Educational Partnership. We're so excited to have you today. Thank you for joining us.
Thanks for asking me. We're very excited to talk a little bit about our programs here at Genesee Valley Educational Partnership. I oversee the medical programs, and the two major programs that we run in this setting where we're sitting right now in our simulation lab is our licensed practical nursing program and our certified nursing assistant program. This room is set up for the students to practice in prior to going out into the clinical setting. So we have simulation mannequins, we have simulation equipment, and we have simulation scenarios. Many of them are computerized, and we can pre-program things prior to the students coming into the lab. So at any time they don't know what type of patient they're going to be met with, we sort of set that up for them. So that's why we're here today, looking at the different equipment and the pieces that we have to provide for the student experience.
So what type of techniques would they be exploring in this room?
In this room, they would be doing vital statistics, so they'd be taking blood pressures, listening to lungs, listening to stomach sounds, listening to heart rate. They'd be practicing, believe it or not, a bed bath. There is an art to bed bathing. They would be ambulating patients, getting them up out of bed, learning body mechanics and the proper way to lift things and how to move patients. They also will learn how to give medications for those in the licensed practical nursing program, and IV medications, and also feeding tubes and feeding pumps. They'll learn how to suction patients as well, and they will learn how to run a code. A code is when you need to resuscitate a patient. So they learn all types of different scenarios right in this setting, in this room. So we're very fortunate. This year alone, we were able to buy 2 new simulation mannequins, which we're very proud to have, and you can do a number of different scenarios with them. We also now have a medication barcoding system, which they do in the hospitals. As you know, everything's gone electronic. So we're very proud to say that we have gone electronic as well. So there's a lot of equipment in this laboratory that we control via computer.
So for those tuning in right now, talk about the Lpn program and just really what you have to offer as far as nursing goes and all of that.
The Lpn program is a 1,200-hour clock program, and the students are in school for approximately 12 and a half to 13 months because we do give some vacation time in there. And they learn all the processes and all the academia that they need in order to pass the licensed practical nursing program, which is a New York State ed given exam. And so they are with us for about, like I said, 13 months. They go to classroom 50% of the time. They go to clinical and lab the other 50% of the time. We also have several different clinical locations that we utilize here. We have contracts with 16 different facilities. Some are long-term care facilities, some are acute care, some are trauma centers, and some are primary care centers. So they get a big array of different experiences out in the public.
A lot of information that you're throwing at us, which is so great, but talk about the passion that you have, teaching these students these techniques and real life scenarios that could happen.
Well, I have not been in education my whole career. I actually have been in different medical positions throughout Syracuse, Rochester, and Buffalo. And I came back to education because it's just so important to me that we train the frontline staff, the people that are working with the patient 24 hours a day, 7 days a week. It's just very important to me as a nurse and as a future patient that we train these individuals how to take care of people when they're at their worst.
And the feedback that you get from these students, I'm sure, is just so great, and it just really goes to show why you're so passionate about it.
Well, it is very rewarding. We get many, many emails, phone calls from students who have graduated. I have 100% job placement.
It's incredible.
I have people calling me. We have recruiters from all the area healthcare facilities asking to come into the classroom and interview the students, talk to the students about coming to work for them. Anybody who comes through either the certified nursing program or the licensed practical nurse program will find a job after they pass their exams.
Wonderful. I mean, there's an LPN program, there's also a CNA program. Do you want to touch on that and what you have to offer there?
The certified nursing program, it is really an entry level into patient care, and that is approximately 150 to 160 hours. They can complete it in 10 to 12 weeks, and then we prepare them to take the certification exam, and they take the exam right on our premises. So we are a certified prometric site, and students can do their examination right here in this lab.
Wonderful. And outside of this room, I'm sure you take your students over to some of the hospitals, some of the nursing homes. Can you talk more about that real life experience they're also getting?
Well, the licensed practical nursing program, they do 4 different rotations. They do 8 weeks in a nursing home environment, and the other 3 rotations are in acute care environment. So we use community hospitals, we use trauma centers, we use small nursing homes, we use large nursing homes. I'm not certain if I should give those names away or not. But they really get a good experience, and they spend approximately 75% of their time once they're through the first 10 weeks of didactic out in the field learning. And even though they're in the clinical setting, they have a pre-class and they have a post-class, so they're always learning and they're always gaining knowledge and getting prepared for their final exams.
Sounds like a wonderful program, and I can just feel your passion. I can really see it. Talk a little bit about what students are saying and really some of their remarks about how passionate they are going out into the field and from what they've learned right in this classroom.
Well, I will tell you, 2 recent grads had come back, and we actually asked students to come back and talk to the students, because any student, when you're getting towards the end, you're a little burnt out. You know, we work pretty hard. We're a 5-day-a-week program. It's a full-time job. And just having those students come in and talk about their experience once they've gone out to the work field. So I've had students come and thank me. I have some working in ICUs. I have some working in primary care, and they're just thrilled. They're able to make good income. They're able to change people's lives. They have an impact on somebody every day that they work, and they're just really excited to be done. And they said every hour was worth it, and you're right. Getting into nursing, you will never regret that decision. Healthcare is ever evolving. You're a constant learner, and new things happen all the time. So it's a great profession to go into.
Well, there's nothing better than saving lives, that's for sure. So do you want to give any shout outs to anyone out there, anyone that you want to thank for, being here or being able to come back and really be that instructor?
Well, I just really like to thank all my clinical instructors. The people that teach for me in the clinical setting, they are so passionate, and it's not the highest paying job being a teacher as an RN, but those people have so much passion and they give their all to the student. And I'd just like to thank all the area hospitals that allow practical nursing programs and certified nursing assistant programs in to work with them and their staff. And it's just, I guess I could be here all day thanking everybody, but the community has been great. Rochester has been very good to us, as well as Buffalo and Batavia, with taking our students in. So without them, we would not have a program. So.
Well, thank you, Genesee Valley Educational Partnership. Thank you, Heidi, for joining us today. If anyone wants to get in touch, how can they do that?
Well, if you are interested in the programs, we actually have a website. Go on to the Genesee Valley Educational Partnership website under Adult Ed, and our licensed practical nursing program and our certified nursing assistant program, they're right online. Maggie's done a great job setting that up. The application process is on there for you, and also the phone numbers, the contact phone numbers. So you could call 344-7788 or 344-7735.
Well, thank you so much, Heidi, and thank you so much for tuning in. We are so grateful to have you today and learn more about this crucial program right here in Genesee County. Thank you so much. If you like this show and would like to be featured, contact us through the Daily News Facebook page or give us a call. We would love to have you.